Oh, hello. My name is Dr. Jeffrey Taylor. I'm a senior POS instructor, and I've been with the company since 1984. That could have been longer than some of you folks have been alive. But I have an interesting couple of stories to tell you about Dr. McGann, the founder of our company, and how he and I came to get together. You don't know Dr. McGann, but he's an absolutely brilliant human being. And when I graduated from dental school, he had this brilliant idea, and he called all the local dental schools, and he said, I want you to give me the name of the top 3 guys in every class, meaning your graduating class, and I would like to interview them. So it was USC, Loma Linda, UCLA. And so he called me on one of those interviews, and I finally asked him, I said, hey, how did you come to call me? And he told me that story, and I thought, man, that was really smart. And he said that he had a lot of associates before that did not do very good work, and he had to redo all that and stuff. So that's how we came to pass. And not only is he really smart, he was like super fast as a clinician. So I thought, well, give me 6 months and I'll be faster than him. And we practiced together for 20 years, and I never did get faster than him. I got as fast, but not faster than him. So he started doing orthodontics with a company called USDI, which is the United States Dental Institute. And he was a student for that company. And he was telling me the story about what happened. And USDI is very disjointed. In other words, like every month there would be a different instructor there that would just talk about whatever they wanted to talk about, whether it be RPEs or extraction cases or whatever the story is. So it took a lot of skill to glean proper education out of this USDI thing. But again, he's smart, so he can do that. And one month, the instructor didn't show up. So they're all sitting in the class. And he's thinking to himself, well, I can't waste this time. So he just got up in front of that group and started talking about the cases that he had started. And lo and behold, the students really liked it. They liked the idea that he, as a student, was telling them about that. So he was telling me he was all excited because he thought, heck, if I can do it with no preparation, just think how I can do it with preparation. So that's how POS was born. And this was like 1982, I'm going to say. And then there was a big debate when he started the first group if he should have me in the class as a student or if I would be his competition, because we practiced together. We had 2 offices, one in Laguna Niguel and one in Santa Ana, and we flip-flop back and forth every day. And of course, the girls were saying, well, of course, you have to let Taylor be in the class so that he can do emergencies and stuff for you, and you can take care of each other's patients. And it made perfect sense. So that's how I came to pass to be a POS student from 1982 and graduated in 1984. And you'll see when you join our program that we need you to start cases very early on in the program. We'll tell you exactly when to start and so on. And that's so that you can learn ortho. And I did it exactly as planned, right when you were supposed to. So the Tuesday I came home from the seminar, I had a case lined up to put braces on because that's how you learn ortho. And of course, it was a disaster, but we can always fix stuff in ortho, so don't worry about that. We can make that happen. And as you know, dental school teaches you nothing about orthodontics. Usually it's how to make a Holly retainer, how to fill out a lab slip, and that's about it, or maybe how to trace a ceph. It's the one specialty of dentistry where you are not adequately trained. And pretty much they told us at USC, they just said, you're not smart enough to do ortho. And simply that's just not true. Orthodontics is not any more difficult than endo or perio or anything else. It's got a steeper learning curve, but it's still very, very doable. So that's why there's such a big need in the GP market for us to do orthodontics. And last time I checked, around 60% of all the orthodontics in America are done by general practitioner dentists, not orthodontists. Because you got to think, the orthodontists want to be on the East Coast and the West Coast, but in Middle America, there's not that many specialists, and they don't want to drive for 3 hours to see one. So your GP usually do the care for you, and that's where we come in. And we provide top-flight education for our GP dentists to practice at the same level or as close as possible to the orthodontist, and sometimes even exceeding the standard of care of the orthodontist. That's super important so that you can avoid litigation, get a great result, make happy patients, because your patients are your ambassadors. They're the ones that are going to get you the referrals and so forth. You're not going to get referrals from other doctors for many years, but in the beginning, a happy patient is going to send other patients to you because they love you, they want to stay with you, and you did a great job on them, so they're going to refer their friends. That's what you need. And we want you to be successful when you join us so that you will be our ambassadors, so that you will refer all your friends to us and so forth. And like that story I told you a moment ago, those people are not going to be your competition. They're going to be your friends still. And if you have difficult cases, you could talk about the cases between yourself and so forth and make it be like a study club environment. And it'll bring a whole new level of rejuvenation to your career, whether you're fresh out of dental school or whether you're 60 years old. it's still an excellent thing as a skill that you should learn. I just finished teaching a seminar here in Orange County. I had 2 students in there, and I asked this one girl when she graduated, and she said last month. So she's already taken ortho because her father was a POS student years ago, and he told her, you must learn this skill. And isn't it funny, the guy that she was with was exactly the same thing. His dad's a POS graduate, and he told his son, you must take this course. And I hear that so many times through the years, whatever, 1987 to now, that's a huge number of years of teaching. And I've heard it so many times. They say, I have no idea how I practice clinical dentistry without this knowledge, because it changes the way you think about everything. And whether it's perio or restorative or full mouth rehab or whatever it is, ortho can always be of a benefit. And those of you who don't know orthodontics, you're doing yourself a huge disservice, because, to place the ideal implant, to do like the perfect full mouth rehab or whatever it's going to do, you're so much better off to line stuff up first. And then you have the proper environment for your restorative to last and hold up in the test of time. And straight teeth are easier to keep clean, even though there was an ADA, the Journal of American Dentistry said that part wasn't really true. People with crowded teeth can keep them clean as well as straight teeth. But common sense says alignment of teeth is ideal for brushing your teeth and keeping them clean. So straight teeth seem to be better. And the other thing I see clinically, when adult patients or young adult patients get braces on, their dental IQ goes way up, and they have to keep their teeth spotlessly clean so nothing bad happens to them. So those good habits of oral hygiene and stuff usually persist for years after that, because they care more about their teeth. They just invested a bunch of time and a bunch of money in making them ideal. So they would like to keep it that way. They want to keep what they paid for, so to speak. Now, not all patients will do it, but the majority of them do. So like I say, it's a fantastic service for your patients. So that's why it's so rewarding. And I'll admit, though, it's a steep learning curve, and it's also sort of expensive. We have more teaching days than any other orthodontic program on the market, and that tends to turn people off. But our program is extremely comprehensive. It's the most comprehensive for any teaching organization that you can think of. So that's why that's so important, because you have to learn all aspects of this in order to treat your patients properly. And we talk about surgery cases, we talk about skeletal anchorage cases, and we talk about all kinds of things. But the core seminar you learn in the first 12 seminars, and that's 4 days apiece. So that's 48 days of teaching. And that, it's not very painful. You can get through that. They meet about every month, every other month, something like that. And you get a great camaraderie with the group wherever you are. If you're in Denver, Dallas, or Phoenix, or Detroit, or whatever, you get to be friends with all these guys and stay in communication with them too. And we have 50 different POS instructors. And we used to travel all over the world to do this. I've been to many, many continents. I can't even imagine how many places I've been teaching for POS. I know between Northwest Airlines and Delta Airlines, I have 7 million miles total logged miles. So think about all that airline time wasted. But wherever you are, you'll have a different instructor many times. So even if you don't like somebody, you'll get somebody later that you do really, really like. And it gives you a varied viewpoint too, instead of just listening to one guy. POS is all about support for your cases. There's always going to be somebody available to help you with your case. So something happens, I'm on vacation or whatever the situation is, somebody would always be there to cover the case for you if you had questions about it. So you're never left out in the cold, so to speak. And we're going to help you diagnose your cases for as long as you need us. Right? Some doctors still use our service after they have diagnosed or treated 200 patients. They still run everything by us just to be sure that it's doing the right thing and so on and so forth. Other doctors that are more aggressive will diagnose or so maybe 50 cases with us, and then they'll stop sending cases because they've seen everything that they need to see and they can do stuff on their own. And that's our goal, is to enable you to diagnose on your own, just like any other aspect of dentistry. You're very autonomous in your practice. You do everything by yourself. You don't ask anybody for any help. And that's the same way orthodontics would be later, once you understand how to diagnose and you have enough experience. But again, it's a very, very steep learning curve compared to the other things. I tell my students in class, and I go, this is not like doing an occlusal composite. You can master that in about an hour. This takes a little bit more doing, but still you have to exercise all the care and the skill that goes along with it. And I will say another thing over the years that I've learned is it's great to have all of these patients that become your friends. And, you get these young people in the chair and you see them from the time they start when they're, let's say, 8 years old. and you do all the way through treatment till they're about 15. And we, unlike orthodontists, we see those patients until either they move or get a new insurance or you retire. So, some of my patients that I did their ortho on, they're now bringing their kids to me to do ortho for their kids. So you get like 2 generations going. And, oh, Dr. Taylor, this is right when I met you when I was 4, that kind of thing. So that's pretty cool. And why else would they bring them to you? Because they love you. They want to stay at your office and you did a good job for them. So it's much, much more rewarding than general dentistry from that standpoint. You get happy patients that come in. They're excited to be there versus that, I hate the shot. I don't like the money. I don't want to be here and all that kind of talk. We hear that every single day of our practice lives. Kind of wears you down after a while. But the ortho is great because they come in and they're like super excited about the treatment. And everybody, it's a win-win because you're going to treat them so well. And again, if you take our course, I know you're going to be a very thorough and a very careful dentist. You're not going to be doing something half-baked. You're going to go all the way and do it very, very conscientiously. And that's what we teach in Progressive. We're not going to do shortcuts. We don't do Mickey Mouse stuff. We do full-fledged ortho, just like the orthodontist does. And all of you today, you know that the digital is the trend of the future in dentistry. And I have no doubt that that's with us to stay. That's never going to go back. It's always just going to go forward. And it's been such a huge, huge thing. Those of you who have scanners, you eliminate the need for that impression taking, which patients hate. And, we can communicate with our laboratories so much better now with the digital dentistry type of thing. And it's just so exciting, all the stuff that's happening in dentistry. And then there's the whole aligner story too, and all the copycat aligners that are out there on the market. And I was telling the staff here at Progressive that I'm not a big fan of aligners because I want to be in control. I want control of my cases. So that's why I still like braces. But as you know, everybody comes in and they all want aligners because that is the wave of the future right now. And the materials that the aligners are made out of are improving every single day. They're getting better and better. And doctors, that's the weak link in a aligner is that material and how it moves teeth. So once they figure out a way to do the exact right force with a long duration of time with a low force on that, I think aligners are going to be perhaps the trend of the future and maybe even replace braces one day. But I can't see that happening. Well, at least in my lifetime, maybe I won't see that happen. But I do know orthodontists that do aligners exclusively. So that is also coming up in our future. So, of course, POS offers a full aligner course, and it's 12 days of education. And we offer an accelerated course that's only 3 days of education for those of you who have a lot of aligner experience. And then we can get right to the essentials of it. And that's what the course is called, is the essential of aligners. So whether you take the comprehensive aligner course or you take the 3-day aligner course or you take the comprehensive traditional ortho course, either way, you're going to learn a great deal. And I'm pretty sure you're going to have a very good time. And you're going to think that it was money well spent, right? And I know the big thing for other competitor companies is they say it's a lot less time away from your family and away from your office, but you just have to spend the time to learn this stuff. And again, it's a pretty steep learning curve. So I think you'll be very, very happy when you join us, and it'll change your whole practice life. It will be really nice. So you've heard me say several times about a steep learning curve in orthodontics. And how do you get over that hurdle? How do you achieve this knowledge base that you need? And the answer is you have to start cases. And the beautiful thing about POS is the skills that you need right away, we teach you right away. And then the patient's time is progressing because teeth move slowly. And as you need the new skills, we are teaching you the new skills. So every step of the way, we're behind you, and whatever support you need, then we're there for you. So, of course, first we teach you how to put brackets on, then we teach you how to tie in a wire. And basically, that's all you need to know for about the first 6 or 10 months, something like that. And then we start to learn how to make level arches, and then we start to learn how to do mechanics and so forth. And as I said, you're going to learn it well in advance of when you have to use it. But see, if you sit there in class and you never have started a case, then I can see my students just looking off in space, like, because they're just bored, they don't know what to do. But all of a sudden, I come across a topic where that patient, that doctor has that exact patient, and they're extremely interested in that because that's what they're doing back at their office. And they ask a million questions about it because they are using this knowledge to work on that patient. So that's why I said at the beginning of this little interview, and I said it's so important for you to start cases early in your career. So when we tell you to do it, you need to do it. All right. And you just have to be confident when you talk to the patient about that. And they might say to you, are you qualified to do that? And of course, you're qualified to do it. You're qualified to do any aspect of dentistry that you want. Once you have started some cases, and then you will gain experience from doing that. And as I said, you have to be confident about this when you speak to your patient. And you're qualified. Like I said, of course, you're qualified. You can do anything you want in dentistry, any aspect of dentistry, as long as you do it to the standard of the specialist. And you will do it to the standard of the specialist. And your next question will be, where am I going to find these patients? And the answer is, you think about all the patients that you've referred to an orthodontist over the last whatever practice years you've had. It's been many, many of them. And also think about the lost revenue that the orthodontist earned that you didn't earn by referring those patients out. And it's probably a lot or some, who knows what the answer is. But once you understand what a malocclusion is, all of a sudden you're going to recognize a ton more patients. So maybe you never referred anything to an orthodontist because you don't know what a malocclusion is, because you didn't teach us that in dental school. But once you learn, then you know, and that's how you're going to treat. That's how you will find your patients, is you will do an orthodontic screening on every single new patient, 6 years old and older. Right? So we will start, you look for oral pathology, then you look for periodontal problems, and then you look for restorative problems, and all the other needs, aesthetic problems, and everything down the list. You just add one more now, and that is orthodontics. And you'll talk about how far off their bite is, and what the problems are, and what the crowding is, and so forth. And it's almost always you can find something to treat as far as an orthodontic case is concerned. So you're actually doing your patient a better service by providing this orthodontic care that they may have never even heard of anybody talking about before. So it's great for you. It's a great service for your patients. And like I said, I think you'll be super happy when you join us in whatever program you decide to take. We also have a dental assistant course, and it's taught by several of our instructors, depending on the location. And that's been super successful too. We have two-day courses regarding that. One is more of the hands-on part that they would treat patients, and the other one is more the technical part to help you with the software and so on and so forth. And dental assistants really, really enjoy that class. And by the way, you're welcome, doctor, to take that class with the dental assistant for free. We don't charge you to take that, so you can understand and hear what we're teaching them. And sometimes you'll learn a lot of stuff too by taking that course with them. We also have several general dentistry type courses, but most of our things are geared specifically toward orthodontics. Like I said, 2 different aligner programs in the traditional program. And we have a free retake offer, free retake for as long as you live. So any course you want to retake, if you've done it once, you can do it again. And we also have several options, because you might have a graduation to go to one weekend and you can't join us. So you can watch it later on Zoom, or you can watch a live recording in class. So you get all 3 options are available to you, live and a Zoom and a recorded live. So I've been asked this question before too about what course should I take? Should I take the traditional one first, or should I take the aligner one first? And this is a very, very individual decision that you would have to make. And all of us get patients every day that walk in and they all want aligners and so forth. And if that kind of thing interests you a great deal, then of course you should take the aligner course first. We're going to coach you very carefully on what kind of cases are good cases to take for aligner courses. But if you are more worried about control and that kind of thing, because a lot of dentists are like super control oriented, then I would suggest you take the brackets course. I think eventually you're going to want to take both of them, but it would just totally depend on what you want to do first. And aligners or braces. Keep in mind, aligner patients, they have a lot easier time with hygiene because they can remove the tray and clean their teeth. And therefore, it might be better for periodontally prone patients, something like that. The compliance or case acceptance is much greater with aligner patients than with braces patients. So that could be another impetus to start more aligner cases per se. But the case has to be relatively simple for it to be successful. And my colleagues that teach the course, they're going to talk about extraction cases and other things that can be done. But to make your life simple, you should be doing aligners on very simple cases. And if it graduates up into something like an extraction case, you're going to need the skill to put traditional braces on. So that's why it might be a good idea to take both. And we encourage you, we even teach you how to put brackets on in the aligner course, because if the patient's not satisfied with the result that you give them with the aligners, then you're going to get permission from them before you start to put braces on and actually fix it. So whatever the patient's chief complaint is, you have to be able to solve that. And sometimes that takes fixed orthodontics to do that. But like I said, the traditional ortho is great, better control and everything, but this is what the patients want today is aligners. So that's where everything is headed. there's so many aligner companies on the market now. There must be at least 5 of them that are do-it-yourself aligners. You don't even have to see a dentist anymore to do that. So you have to emphasize to your patient how important it is that you are controlling the shots here, and you are telling the aligner company what you need and what's to be done. Somebody has to manage the perio during the aligner therapy and all that kind of thing. So it really should be done with the intervention of a dentist, not just one of these do-it-yourself aligner companies. All right. So